Why is cancer now being seen in a younger age group? What is the role of environment, pollution, active smoking, passive smoking?
Policy is good only if it can be implemented well.
I think it is we who have to raise a noise and say that, look, it has to be implemented. Can I fine you back if you don't do your job?
I have to say that the lawmakers are not serious about the compliance of this law.
Is it because the tobacco industry is very strong?
I think it is citizens who have to make it into a movement.
There is no way we can be an advanced country if we don't take these measures. Simple measures. If you don't elect the right people, they are supposed to represent you. If they are not representing you, it's not going to happen. Hello everyone. Today our Antardhwani team is here. We have an interesting conversation about some of the health issues and how certain diseases are getting worse, particularly non-communicable diseases. Let me introduce the persons. You have Seethalakshmi, who is a former editor of Times of India, who has been in Antardhwani for several years now.
Yes.
Rahul, who has also been there for a long time, and he was a former deputy editor. Then the new addition, Ranjani Madhavan, who has been with us, who was at the Australian consulate. So now she has joined us. So the whole idea is how do we, bring up certain issues facing the society today, and what is the role of the people? What should be a people's movement? Can we expect government to do everything? What should be the role of the government? People call it by several names. Some people say it is activism. Some people say, we are social activity. Some people say, in a light-hearted way, you don't have anything to tell, you take up these jobs to do. So, I think essentially certain amount of activism is important. Recently we see in various parts of the how mass rallies are held, and through that we are saying to send a message. Similarly, one of the areas, Bangalore, when you look at it, has various issues, but one of the important issues is health. Recently, there was a big article in a major newspaper in US, the New York Times, talking about cancer. It was written by an oncologist, and it was well appreciated because we all know what are the causes of cancer. Why is cancer becoming prevalent? Why is cancer now being seen in a younger age group? Between 40 and 60, actually it is more common. In our medical college days, we used to think it is an aging process, no longer. So what is the role of environment, pollution? What is the role of, active smoking, passive smoking, exposure to these kind of issues which has herbicides, pesticides. So these are all some of the things which sometimes we really don't want to talk, but we have to address this issue, right, Seethalakshmi? What do you think?
Absolutely, doctor. I think considering that so many people are going out now, and all the more that, smoking in public places needs to be implemented to the core. But it looks like in many of these places, you see that the implementation is very, very poor. We do have a lot of laws. India has the highest number of laws for many things.
We have a lot of laws.
Lot of laws. But I think the implementation is where we fail. And like you rightly pointed out, I think it is citizens who have to make it into a movement.
What is wrong in implement? Why are we not able to implement
That's
the
a
law?
big question.
Yeah.
So what Seetha is telling, Dr. Ajay, is that India has lots of laws, but there are little implementation.
If you look at the law, it says great country.
Yes. I feel one big problem is coordination among various departments in India. So there is no department of coordination in any state, which coordinates with like in designated smoking areas, which we are talking. There should be one coordination department which kind of coordinates with 5-6 stakeholders, like the police, like the health department, like the civic administration. All this should work in tandem, which is not happening here. So merely having laws is not enough, This is what I feel.
I would like to add
Yeah,
to
Ranjani.
that. There was a ban that was tried out in Mumbai on loose cigarettes. But when they did a research study to see how effective it was, they found that none of the authorities knew who has to enforce it. many didn't know that there is such a law. And then they didn't know who was supposed to enforce it. Is it police? Is it the municipal corporation? Health department? They wouldn't know. So again, that's...
But Ranjani, a simple thing like a big sign, under the law you are not supposed to smoke. We don't even see like the restaurant we went to on a Saturday night in also, didn't even have a sign, and there was rampant smoking. We couldn't, after paid some entrance fee and all, we couldn't even stand there for 15 minutes. And they claimed that they had a designated area. There was absolutely no. So what do you think is happening? Why are we so lax in this?
I think that comes back to enforcement. There is no enforcement of the law, and a policy is good only if it can be implemented well. Otherwise, it's just having it on paper is not of any use.
Seethalakshmi, what is our role? Because we go and expose. When somebody is not, what is the role of the citizen?
Absolutely. Doctor, I think if 4 of us who are non-smokers go to a place and there is no designated area there, I think it is we who have to, raise a noise and say that, look, it has to be implemented. Now, if you're going to come back and say that, oh, this is not happening, that's not happening, that's not
Too much of crowd, we can't
Absolutely.
control. What?
We don't want to take it up as people's issues, See, everything. You look at garbage in Bangalore. You look at today, the BBMP has put out a new rule that you all will be fined. So why is it that the onus is always on the citizens to do things? Can I fine you back if you don't do your job? So I think people's movement is what everywhere has succeeded in getting laws implemented.
What even the law has a very small penalty for can you talk about, and they're going and paying 2,000 rupees entrance.
Absolutely.
If there's a penalty is 2,000, it's a so what, I'll pay and smoke.
200 rupees.
200 rupees. So is that the right thing?
It's not the right thing. First, I will take this opportunity, Dr. Ajay. We have been researching on tobacco for our team together. And designated smoking areas, as per Section 4 of the Kotpa law, what all it designates, let's talk about it 2-3 minutes. It mandates a 4-roomed wall, whether it be glass or concrete. It also mandates a separate ventilation, exhaust, with no recirculation. The entire exhaust should go outside. Second, it also mandates negative airflow in that room. That's a concept which keeps the pressure low in that area and also smoke low in that. That's a technique. It also mandates what you said, a large display which says under 18 years of age are not allowed. This is a designated smoking area. We don't see those as well, So, where Ranjani said that there is a room in this place you went.
Yeah.
You said there is some room. That shouldn't be that some room. By law, you should designate an area which is proper smoking room.
Correct.
That is what is not happening, Like you said, and also last point, 1 to 200 rupees is the fine. In today's time, can you imagine 1 to 200 rupees for this violation? That means I have to say that the lawmakers are not serious about the compliance of this law when you put 200 rupees as a fine.
It's really a joke.
Is it because the tobacco industry is very strong? Is that maybe the reason the lawmaker, because lobbying by the tobacco industry is so much, they are not allowing this kind of more effective law?
Actually, that was found in the same study that was done on the Mumbai ban. They found that there was a lot of lobby from the tobacco companies, and it would be in the form of bribes or some other kind of incentives. So it's not a priority for the enforcer to actually.
So health is not a priority for us.
No, not
absolutely.
Money is a bigger priority.
Absolutely.
Is that
As an oncologist, I think you will tell us that how passive smoking is also leading to stage 4.
You are absolutely right. As an oncologist, Rahul, we want to really win the war on cancer. Like I always say in my talks, if cancer is no longer there, I would rather find a better work to do, better thing. But unfortunately, because of the challenge cancer posed, we took up to be oncologists. So having done that, I like to simplify it and say what I call as simplicity in complexity. Rahul, you can talk about the work we have done with farmers.
Yes.
Okay?
Absolutely.
What is the work we have done with farmers?
So, we have done a wonderful work in this side. Nobody thought, I feel, that there should be done something to address the root
As a
cause.
cancer hospital.
As a cancer hospital. As a cancer hospital, no other health institution has done this to address something from the root cause, that is cultivation of tobacco. So near Hunsur beyond Mysore, we went around and we did a research of about 6 to 7 months. We built a cohort of 50 to 100 farmers, convinced them with agronomists, researchers. We also bought people who were growing other crops, and now these people, many of them we met recently who are in touch with us.
And we are doing a big program.
Yes.
Absolutely.
I think the important thing here is we are trying to send a message. It may or may not make an impact. The message is very clear. Please do not grow something harmful to the farmers, their families, and the public at large.
Absolutely.
All three stakeholders are going to harm. Only tobacco industry will prosper.
Exactly.
And once we started doing, from what I hear, the tobacco industry came and said, we'll pay you more. That also was done to
Absolutely.
stop the alternate farming, right?
Yes, yes.
So we are as a cancer institution, research academic, we are appalled that the government has not taken more active roles. We also return to government, whatever the tax money you generate,
Yes.
help in cessation of smoking, bringing certain issues, more penalty for the people who smoke public. Most of the advanced countries have done it. Unfortunately, we want to be advanced country. There is no way we can be advanced country if we don't take these measures. Simple measures. Health is a priority. Cancer is increasing.
Right.
By any standards, we think cancer will be 1 in 9 now. It could become in India even 1 in 6, 7. So imagine the magnitude of the socio-economic issue of this. Imagine how much people have to spend with cancer. In India, we always talk about the cost. We talk about cost, what is the cost of treatment, and we read about people have broken their families, they've lost their wealth, and they've gone into poverty. Man, the best way to avoid poverty is to stop and ban tobacco. But nobody wants to do that.
Nobody wants to.
Why do you think nobody wants to do
We're
that?
also sitting on a lot of money. It's 75,000 crores that can be used into cessation programs every year, which is just unused.
Tell me about it. What is the 75 crores and what can they? This is the tax money.
This is the tax money. It's supposed to go into cessation programs, but it's not. We have similar things for alcohol. We have different states that implement de-addiction centers that help you in counseling. We don't see that kind of movement with tobacco. We see
But
that
they
kind of-
all announce sometimes in the budget, but they don't execute it, like what you said. None of it is executed, right?
Right.
Yeah.
I'm not going to accept this thing that we are always governed by this lobby, doctor. In every field, if you're telling that there is a lobby, then what is the government there for? Like if I'm saying that I'll succumb to every lobby. So
Correct.
is
So
there
what
a
is
way-
the solution?
So to me, it means that the citizen is the one who can come out and, ensure that the law is implemented.
So, but in that,
Pick it up as a
Dr.
battle.
Seethalakshmi and Rahul, don't you think in order to do that, we have to elect the right people in elected offices? Is that not important? Have the right bureaucrat, right elected people. If you don't elect the right people, they are supposed to represent you. If they are not representing you, it's not going to happen.
Absolutely.
You can shout every day, but if the representatives of the people are not doing it,
Absolutely.
Completely.
Okay.
Completely.
what do you think?
I agree with you. One more point of this, doctor, is that when the ordinary citizens don't make a noise, then nothing can happen. When you don't raise voice for yourself, you cannot expect anything. You don't even raise voice to your representatives.
Correct.
You are very happy sitting in your home. You cannot expect anything. We often touch, doctor, one point I'll make here. India's defense budget is 7.5%. The health budget remains to be less than 2.5%. So when our people, our soldiers won't be healthy, their health will not be taken care of, how do you expect them to fight?
Fight in the border.
So they're all health is correlated to everything.
I mean, health and education are so important.
Two pillars.
And for coming to the smoking, there is no doubt the issues like smoking, chewing tobacco, I see patients all the time. Advanced cancers I see are all related majority to this. Even passive smoking, particularly in a childbirth age. when the woman is exposed to passive smoking, not only the woman is harmed, the future child is also harmed. It is called epigenetics. And people are not realizing this. That may be the reason we are seeing, a 20-year-old, 19-year-old people getting cancer, which was never thought of in the past.
So even if they don't smoke, they get it genetically.
Yeah, because if you don't smoke, the woman is exposed to the passive smoke for a spouse, or if she smokes. We see a lot of women also smoking. Other day when I went to restaurant, I saw a bunch of women smoking. But so they are in the reproductive age. So they are going to go through genetic changes. When the child is born, they are likely to have certain mutations, as though they have smoked.
Okay.
Even though they have not. They are innocent, but they will have this problem.
Yeah, this is the most powerful message, I think, to any lobby that's working on.
I think this is not understood. And in a parliamentary committee, I was appalled when a parliamentarian asked me, "Doctor, does the smoking really cause cancer?" So when I said why we should ban smoking, so I think there are a lot of reasons we can give, but the least I think the government can do, the system, police can do, is to make sure in public places like restaurants, of course in airports people don't smoke now, they are controlled because they are all privatized now. In restaurants, in other public auditoriums, public places, and working places, we make sure smoking is not allowed, and there is a designated place or an outside they go and smoke. I think this is a must, particularly in hotels and restaurants. It has to happen, and the importance of passive smoking should be stressed. No, I think.
Absolutely.
What do you think? No?
Yes, of course. See, I think when you say as many people are getting into smoking, there are also people who are getting out of it. And then for them to be in these places, and you are so evidence-based, HCG has so many cases, like you say, you see patients in and out who do these passive things. So, coming back to this point, Doctor, I'm very clear that it is the non-smoking people who should revolt and say that we are not going to sit in a restaurant where smokers are sitting there. We are not going to be seated there, and then get the laws implemented.
And I think the issue is also having stringent law. I think we as a public have missed out on this. What we do is the last day of May or so, we have some kind of a World Tobacco Day. We protest across, and for the next 12 months we go back to our old habits. I think every day should be a No Tobacco Day. How do we do this every day is a challenge. Hopefully we can take up, Rahul, we can certainly try to improve the stringent law.
Yeah, sure, definitely.
What should be the law?
I think we should, like you said, first is raising your voice. First is creating a public campaign for this, Like you said, how many people know that even when you don't smoke as a young woman, when you are at that time, that you can get that disease.
Correct.
Not many people. There are several points in which a public campaign can be addressed. Second, can we take this, because if it's a central act, can we take this legally to make a public campaign will support this legal intervention, in courts maybe.
What are your thoughts as we close this part of the discussion?
So, Doctor, it's very important that we start a movement to ensure that the designated laws are implemented. Now, we don't need to go and ask for fresh laws in anything. There are already laws. So how do we, as backed by evidence, I always feel we are in a very advantageous position as Antardhwani, because we are a think tank of, headed by you. So we have evidence to show that this is what is happening. So, and therefore, I think from the health point of view, the fire has to be only from the health point of view.
And what about creating better awareness of the media, of the overall people who are supposed to support? Is media doing enough to create awareness about it?
So what happens, like you said, once a year, being from a media, I can tell you that once a year, the World No Tobacco Day, we do an entire page and then everyone forgets and everyone just moves on. So is there a consistent campaigning? Now, in spite of this awareness, Doctor, I think we should move out of this awareness. Everybody knows that the pub that you pointed out earlier in the conversation, knows that it is not right on their part not to have.
You go to
AC.
movie theater, you see, oh, cancer, this.
Exactly.
What is the
So
impact it is
we are
having?
beyond this awareness now. Now it has to be like Nepal, where we will say that we will fight and get the laws implemented. I think if we don't have that push, awareness is there. You're right that we have to keep on writing about it. But writing, nobody cares. You think the politicians who are bothered about any write-ups in a newspaper? No, they don't.
And we should elect the right representative.
Right, Susan.
Yeah.
We should question them, debate them, and they write like the right.
And make him or her work
Yeah.
to say that
Ranjani,
this is
you said we have some funds. How do we bring about this awareness about the funds, cessation program, and even using the funds for health of the smokers? How do you think Antardhwani can do?
I think-
Through what process actively we can do?
I think as Rahul and Seethalakshmi rightly pointed out, we need a citizens movement towards it. Otherwise, the law for the policymaker, this is not a priority. They are not going to listen. They are not going to read articles that you write. So we need a citizens movement, championed by Antardhwani to push for the 75,000 crores to be actually used in cessation.
Should we
programs.
file an RTI
Definitely, we can. That is one of the
and then
ways.
go for a PIL to say, why have you not used the money?
Absolutely. It is only the courts
It
that
may
can.
take years, but we have to fight. The system takes long time.
Yeah. And we can also look at increasing the fine because 200 rupees is not a deterrent.
Not at all.
So that is one thing from the legal aspect that.
And also, I would say they should be also think of putting them behind bars. The restaurants should be shut down. You say, hey, if you don't do it for 1 week, we'll shut you down. I think that threat will help a lot,
That-
shutting
that's
down
not
the
there.
process.
Enforcement. Yeah.
A penal action is just up to 200 rupees.
Singapore has
what is this
very, very
definition?
stringent laws.
Very stringent.
I think these are the matters we should take it up certainly. And let us keep talking about it and see what are the changes we bring up. Of course, we will be meeting the police commissioner. We'll be actively writing to the restaurants. We will see. There are other issues also in a city like Bangalore.
Right.
Of course, there is issues which are public nuisance issues, pedestrian issues. We should all talk about it as we go forward. We'll address it in our next podcast in terms of parking on the footpaths. What is the pedestrian deaths? What are the number and crossing the road. Major issues are there. We should certainly take it up and discuss as we move forward. Okay?
Yes.
Thanks a lot. Thank you.
Thank you.
Thank you.
Thank you, Doctor.